Thank you very much, Anne. So, my name's Louise Irvine. I'm standing for the National Health Action Party in the London Euro elections, and I'm chair of the Save Lewisham Hospital campaign, which fought a successful battle to save our local hospital. So we recognise and support your struggle here to save Charing Cross and Hammersmith hospitals. But the whole NHS is in grave danger. Not only are our hospitals under threat, but also GP practices, community, mental health and maternity services. Staff morale is plummeting and patient care is suffering. The NHS is being starved of funds, fragmented, sold off, privatised, and run down by the Tories and their Lib Dem sidekicks. They're getting away with it by lying, denying there is privatisation and cuts. But already £5 billion worth of NHS contracts have gone out to tender, and 70% of contracts have gone to the private sector, using the NHS logo to hide the reality. Yes. Billions have been cut from the NHS budget, with billions more cuts planned for the next 5 years. The Tories and Lib Dems declare that the NHS is failing, and what it needs is even more privatisation and more cuts. It's clear the NHS will not survive another Tory government. But can we just rely on Labour to come to the rescue? Unfortunately not. While there are many good Labour Party members campaigning to defend local NHS services, what matters is what Labour would do in government. Saying they will repeal the Health and Social Care Act is welcome, but it's not enough. The last Labour government was the first to privatise NHS clinical services, and they still refuse to say they will end privatisation. Their promise to honour Tory spending plans means they won't increase NHS funding, and they have no policy to deal with the private finance initiative debts which are bankrupting hospitals around the country. The National Health Action Party is made of doctors, nurses, health professionals and ordinary people who feel passionately about the NHS. We're demanding an end to privatisation, an end to hospital closures, increased real terms funding, safe staffing levels, scrapping PFI, and opposition to TTIP, the EU-US trade deal that would lock in NHS privatisation permanently. Winning an MEP seat would send a very powerful message to politicians in Westminster and Brussels that people want an end to the privatisation and running down of the NHS. It would show the tide was turning, that people were waking up to the threat to the NHS and saying, enough is enough. It would help build the kind of movement we desperately need to save the NHS. Please support us, please support the NHA in the London Euro elections, and please support Didi Wilson standing for the NHA in Munster Ward in Fulham. Thank you.